Hi, I'm Dr. Constance Scharf, and I am here to talk with you today about the White House panel's new recommendation to declare a national emergency about opioid abuse and opioid overdoses across the nation. Now, this is very strange wording to come out of a medical panel because national emergencies are usually for natural disasters, acts of terrorism, or acts of war. It would be extremely unusual unless there was a huge outbreak of, say, Spanish flu, which we had a century ago, to have a national emergency about a healthcare issue. But it is possible, and it is something that the government can issue. While this focuses attention on the problem, what I have to ask is attention what we really need. Is there anyone in the nation who doesn't know that opioid overdoses are a crisis in every community, in every state? We're losing 142 people a day on average to overdoses in this country. And the number keeps going up pretty steadily. We're right around 60,000 overdoses a year, which is unheard of. I mean, this is something that the medical community has not seen before. So it's interesting to me that the first edict from this, or first suggestion from this group, and their full report is not due until October, in all fairness, is to shed a spotlight on the problem. So what I'm going to suggest is something that we also already know, at least in the medical community. And that is that the #1 problem facing addicts is lack of access to quality treatment. Most addicts can't get in and have to wait sometimes months to get into a treatment center. And when they do finally get in, even if they have private health care, I'm not just talking about Medicaid, even with private health care, addicts very often stay less than 21 days before their stay is either stepped down to residential treatment or terminated altogether. And let me just say flat out, that is a recipe for disaster, right? Because we all know that addiction isn't solved in a 21-day stay. And if someone is willing to go to treatment today, we can't wait 2 or 3 or 4 months for a bed to free up, because every single day that addict is using, and every single time they use, they can overdose and they can die. You know, I work in the addiction treatment field, and, you know, parents, I can't say enough how devastating it is. Not just to you, because you only have to bury one child, right? But to all of us who have to watch you day after day after day, do the very best you can for the people that you love and not have anywhere to turn. So I implore you, please, seek care now. If you have private insurance, great, because a treatment center like ours or another will advocate for you as much as possible with your insurance company. But we need to stop focus all the attention on addiction and look at what the real problem is. The real problem is that Americans need better access to mental health care and addiction treatment, and that comes from continuing to expand, not retract, Medicaid, and also to provide better insurance, to command the insurance companies that they have to pay for these services. That's the way you save lives. If you have a loved one who needs help, call us. If we can't take you in, we'll try to give you a referral. Please don't let another day pass without getting your loved one the care that they need.